what would be the best time of day, and for how long should we stay under the sun to get the much needed dose of vitamin D?
Okay, thank you for asking this question, Genevieve. It's actually it's very significant, and also, I have to highlight first that the vitamin D is called also the sunshine vitamin, just because we can get it through exposure to the sun, because we have a precursor on our skin, and then it gets this synthesis of vitamin D gets triggered once we are exposed to the sun. However, this is not a simple question, and the answer is not like a one answer that fits everyone, because it all depends on different factors. So, for example, it's all related to the UVB light rays, and a lot of factors, they affect the efficiency of this process. So, for example, you have to consider the time of the day, you have to consider the latitude, you have to consider sometimes like if there's pollution, humidity, what we call UV index, different things that come into play. And also, there's no like one straight formula for everybody, because it depends again on different factors. For example, if someone is obese, or someone has a darker skin complexion compared to another, different according to the age group. For example, like as we grow older, we will lose our efficiency to synthesize vitamin D. So if we, for example, like someone who is an adult, like mid-age, let's say, can get the body requirement by exposing himself or herself for 20 minutes. As we go older, we will need maybe double the time. So it's very, it depends on different factors. In general, like if someone has like a fair complexion, because as the darker the skin complexion it is, the longer the time you need. Because people who have a darker skin complexion, they have this skin pigment, the melanin, and this absorbs the UVB ray, so it reduces the efficiency. So someone who has a lighter skin complexion can spend, for example, like 10 minutes, as compared to someone who has a darker skin complexion who needs probably like 15 or 20, compared to that same person if they have like almost the same age, let's say, in general, like same weight and all of that. But in general, like the good time to be exposed is between 10 a.m. and 3 p.m., maximum 4 p.m., because this is like, the good angle that we have from the UVB light reaching the earth. However, sometimes, as we know, also in the summer in the UAE, this is really like a very hot time of the day. So, in the summer when it's really, really hot in the UAE, it's good probably like to go out like very early in the morning, like maybe like something between 8:30 and 9:30, because it's still like there's sun, and still, it's not too hot. And the same, like, maybe like later in the afternoon. The only issue is that if you choose to stay, like, choose to pick the ends of the spectrum, so like early morning and very late in the afternoon, you have to increase the time that you spend. So example, instead of staying for like 10 minutes between 11 a.m. and 3 p.m., you will have to stay like 15 or 20 minutes, depending on how strong the sun is and all these factors. So it's kind of like a mix of all these parameters that you have to consider. The good advantage about vitamin D and how we can get it through the sun is that it doesn't have to be on a daily basis. So for example, if especially nowadays we're like staying indoors because of COVID-19, or sometimes because of our lifestyle, like we're always working indoors. So let's say throughout the week you're not exposed to the sun, but if you can get exposed throughout the weekend, that is perfect. Like it can compensate, so getting exposed for like even 1 or 2 days for some time can compensate for this, like, lack of exposure to the sun throughout the weeks.
I see. So, well, somehow you answered the last question, like, because the question was, does the dose of vitamin D needed change with age? And somehow you answered that, but yeah, if you could elaborate on that, that would be great.
Sure. Sure. So you're right, Genevieve, because we talked about different requirements throughout different life stages. So for example, if someone who is young or someone who is elderly or someone who is pregnant, then they have usually different body requirements. And I have to tell you something about these requirements. They keep on changing actually, because as you know, physicians meet and researchers meet almost like every year. They try to revisit these guidelines and the see whether the recommendations can be increased or they are enough. So in general, there's a lot of debate about like what's the actual recommended dose. But recently they have really increased the recommended limit. And usually we talk about like children and infants, they can take anything between 400 international units to 600 to even 800. And adolescents, teenagers, like maybe up to 1200. And adults sometimes even to a 1500, and elderly as well. And especially if a person has a chronic disease like diabetes, multiple sclerosis, all these cardiovascular disease, hypertension, they really recommend that they take a good dose of vitamin.
All right. So we understand that you have been actively campaigning for vitamin D awareness. So before we end this interview, do you have any message to your fellow medical professionals and their understanding of vitamin D?
So yeah, I mean, like I'm really very interested in spreading awareness about vitamin D, because people like think that's only a vitamin, but as we explained, it has more of comprehensive role. It's very important. So I try to always educate people by sharing information, by sharing the latest scientific research. So I always try to explain some of the latest studies that have shown that there's, for example, an association between vitamin D and or vitamin D deficiency, let's say, and a specific disease. But I also try to look for always like the updated information, because this is science, and we know that there are a lot of studies out there. Sometimes there's controversy. There are some studies that show there is a protective effect, but there are like other studies that show there's no protective effect. But we have to really consider each study specifically, and we have to see like whether the design is the same. We have to look at whether this is just an association study or it's an RCT that tells us about causation. So many things that come into play, and also maybe like encourage people to really get tested, at least, as I mentioned earlier in the interview, at least like once a year, because they have to be aware of their vitamin D level. And if they have vitamin D deficiency, they really need to correct it. And also, be aware of the sources of vitamin D and how they can get vitamin D, how they can optimize the level of vitamin D. So they have to take care of their lifestyles, like change their lifestyles. For example, if they know that they don't go out in the sun at all, try to go out a little bit more. Try to focus on the healthy food that is rich in vitamin D. So if they don't like, naturally rich food that is enriched with vitamin D, look for those that are enriched, or fortified. So look for milk that is fortified, for example. And if they think that they have a chronic disease, or they think that, because of their lifestyle changes are a little bit difficult to change, they can also look for supplements. So try to have more of like a holistic approach about vitamin D, and whether they might be having vitamin D deficiency, they might be at risk of it, and overcome it, and try to educate themselves all the time about the protective effect of vitamin D.
Well, thank you very much, Dr. Fatme, for your time, and take care.
Thank you so much. Thank you, Tanvi.
Thank you.
Bye-bye.
Bye. Thank you. Bye.